A very warm welcome to all the dignitaries on the dais. Graduation Day is always a day of rejoicing, for it marks the conclusion of an educational journey and the commencement of another more uncertain and more difficult part of man's quest for a better life and future. Truly, today signifies the culmination of many years of hard work in the relentless pursuit of knowledge. Knowledge that will enable a person to embrace opportunities and take on challenges with clear vision and purpose. I once again welcome everyone to this occasion. Now I request Mrs. Aruna Malani Madam to please come forward and honor our chief guest, Srimati Gadwal Vijayalakshmi Garu, Honorable Mayor of Hyderabad, with a flower bouquet. Now I request Divya Malani Madam to please come forward to present a flower bouquet to Dr. Sapna Marda, radiologist, Yeshoda Hospitals, Secunderabad. Now I request Mrs. Rajshri Jain Madam to please come forward to honor our esteemed guest, Sri Vinod Agrawal ji, with a flower bouquet. I request Srimati Usha Malpani Madam to please come forward to present a flower bouquet to Manju Kothari Madam. I request Saroj Bajaj Madam to welcome Dr. Sachin Marda sir with a flower bouquet.
सर सर सर
सर इधर देखिए
May I now take the pleasure of requesting our respected Dr. Saroj Bajaj Madam, President of Mahila Dakshata Samithi and its educational institutions, to welcome the gathering.
Guests on the dais and august invitees, Namaskar. We, the management of Mahila Dakshata Samithi and Bansilal College of Nursing, trustees and faculty members, respectfully extend warm welcome to all of you to this second convocation ceremony. It is our good fortune that Srimati Gadwal Vijayalakshmi ji, Honorable Mayor of Hyderabad, is with us as chief guest of today's function. She is daughter of Dr. K. Keshav Rao Garu, Honorable Member of Parliament, Rajya Sabha, and very senior politician. She did her graduation in journalism and studies LLB. She was in research field in cardiology department in Duke University, USA, which is 5th largest research university. After return to India, she took up politics. She was remarkable development Banjara Hills division and made remarkable development. This led her to become mayor of Hyderabad in February 2021. She is in the first woman mayor after formation of Telangana. Venerable and celebrated Madam Ji, we are extremely grateful to you for accepting our request, sparing your valuable time. Our students are indeed very lucky to receive your valuable message, which will be of immense help in building up their career. We, with all humility, adoration, and respect, welcome you, madam. Now we heartfully welcome कविता जी तो आई, करुणा जी तो आई नहीं है, आज किसी कारण से वो नहीं आ सकी हैं क्योंकि उनका असेंबली में शायद मीटिंग थी. We now welcome Dr. Sapna Mardaji as a guest of honor. She is a renowned radiologist now working as senior consultant at Yashoda Hospital, Hyderabad, a topper in the school and medical universities. She is a perfect combination of fantastic skills, cutting-edge knowledge, and empathetic patient care. She has successfully reported multiple complex cases and performed many interventional radiology procedures. She has touched thousands of human lives, gifting them a second inning of life. She is known as a doctor of the doctors. Sapna ji awarded. Sapna ji is awardee of Frank Doyle Gold Medal, FRCR, London. M.Med from Radiology, National University, Singapore. Fellow Clinical Oncology, Gujarat University, and several others. She had 8th rank in MSET, 5th rank in Usmania Medical College, 3rd rank in MD Radiology Diagnosis in NTR UHS, Andhra Pradesh. We are lucky to have such an illustrious person today with us with very high credential, and it is a great opportunity for our students to emulate her qualities. Now we heartfully welcome Shri Vinod Kumar Ji Agrawal, IAS, as guest of honor for today's event. He was a special chief secretary to Government of Telangana and held various important positions and portfolios. He has been very kind to us and to our educational institutions, providing support and guidance as friend, philosopher, and guide. Vinodji has very rich experience, expertise, and vision. I further would like to extend a very warm welcome to all the distinguished guests, trustees, donors, volunteers, press personnel, electronic media, staff, students, and all other present here on this momentous occasion. A little bit of shortcoming is that the auditorium is smaller for the occasion. At the earliest, this problem can be surpassed by very large auditorium with better and latest equipment. A new building is coming up in the premises in the name of Nirmala Goenka Girls Hostel, containing big auditorium. The building is A new building is coming up in the premises in the name of Nirmala Goenka Girls Hostel, containing big auditorium. The building is spread over with 1,15,000 square feet area. The chief donor is Sajjanji Goenka. He is also trustee. Husband of late Srimati Nirmalaji Goenka. We take this opportunity to express our gratitude and sincere thanks to him, other donors of the family, and others who made valuable contribution in this magnificent project. We are happy that Srimati Rashri Jain, daughter of Sri Sajjanji Goenka, is now with us in this function. We extend warm welcome to them. Rashri, further, Maharani family is extending continuing support in running nursing college. We take this opportunity to thank Srimati Aruna Malani, wife of late Shri Bansilal Malani, my family members Shri Krishna Kumar Malani and Srimati Divya Malani. We extend warm welcome to Srimati Arunaji and her daughter-in-law Srimati Divya Malani, who are present in this function. Last but not the least, Manjuji Kothari, wife of late Anandji Kothari, who was former chairman on NMDC, Hyderabad, had close relation with us and with our educational institutions. She came down from Udaipur today only to attend this function, which amply speaks about her affection for us. She is simple by nature and high in thinking. She and her husband extended financial assistance and moral support to us from time to time. While sincerely thanking them, we heartfully welcome her to this celebration. We now explain in brief about our organization. The journey for empowering women started way back in 1991. We believe that this could be achieved only when girls go for higher education. Since then, we focused on the weaker section girl population belonging to rural areas. This section of the population is mostly dropouts of the school and rarely pursues higher education. To address this challenge, we had to first establish a hostel in 1994, which was inaugurated by Shri P.V. Narasimha Rao Ji, the then Prime Minister of India. We started junior college in 2002, degree college in 2005, and vocational junior college in 2010. Our BSc Nursing, B.M. Arani Nursing College was inaugurated in 2016 by Shri 7,000 girls passed out so far. We have very dedicated faculty. We have very dedicated dedicated faculty who spend time with the students even after regular classes to help them in achieving their dreams and goals. This commitment resulted in our students securing state rank and also good job in various organizations. In the recent visit to Hyderabad, Srimati Draupadi Murmu, Honorable President of India, was kind enough to interact with 3 top-ranked students of our college, who presented their success stories. Her Excellency appreciated and blessed them. To conclude, I would like to convey my sincere gratitude to everyone who is present here, making the program memorable. I also appreciate the outgoing nursing students for their good conduct and commitment in studies shown in the last 4 years of their graduation. I congratulate them and wish them all success in their future assignments.
Now we have the most awaited moment. Now it's time to acknowledge the talent of our brilliant buddies. The fruit of hard work and discipline is finally reaped. You will now be receiving your prized degree, a symbol of accomplishment. May I request Mrs. Vindhya and Uma Maheshwari, Professor of Nursing College, to help in the distribution of certificates and mementos. I request our Honorable Chief Guest, Madam Gadwal Vijayalakshmi Garu, Mayor of Hyderabad, to please confer the degrees to the novice graduates. Candidates receiving the degree, please come forward as your names are called. Hema, she is the college topper. P. Suhasini, she has secured second rank in the college. P. Suhasini. She has secured the 4th position. To come forward, Sumanji. Priyakirtana. A. Swati. Bhavani. Deena Kumari. Sushma. D. Pravalika. Sarita. Sarita. Sabyata Dubey.
Sir, question.
G. Stella. Sai Kumari.
सामने देखिए सामने
S. Navanita.
Yeah, ready. Madam. Madam ji ikkada.
B. Akila. Girls, please give a big round of applause. Priyakirtana. I request Sumanji to come forward. Sumanji.
Madam.
Priyakirtana. Ramya. K. Amulya.
This side.
Pooja. P. Saundarya.
Madam.
Tanas Fatima. Yasin Begum.
Yeah, ready this side. Ready?
A. Swati. Bhavani.
This side. Ikkada. Sir.
Ma, look here, you know.
Geeta Shri.
This side. This side.
Girls, please give a big round of applause. Rajita. K. Madhuri.
come close yes everybody yes
K. Madhuri. Barnali.
Ready, this.
K. Sirisha. B. Gunavati. Snehalata. K. Sirisha.
Yeah, madam.
Barnali, please come forward. I request Miss Deepa, please come forward. Deepa ji.
Madam.
Snehalata, please come forward.
Madam.
सामने देखिए मैडम।
Yeah, madam.
Our students of Suman Junior College
ग्रुप
have excelled in the Board of Intermediate Examinations held in March 2023 and have secured state ranks. I request Madam to please give away the mementos and certificates to the students. Madhya secured first rank, state first rank in CSC group. Please give a big round of applause. Madhya. Chakali Leelavati secured state first rank in MTHW first year.
Madam. Chana, ikkada. Madam.
Bellamkonda Manju Bhargavi secured state second rank in MPC. Kummara Harini secured state third rank in MPC first year. Kolla Sumitra secured state fourth rank in
Madam.
BIPC first year.
Chana.
Natakari Pratyusha secured state fourth rank in BIPC first year.
Chana, ikkada.
A very hearty congratulations to the new graduates of the nursing college and also congratulations to the students who have secured state rank. Well done, students. Thank you, madam, and all the dignitaries for patiently distributing and conferring the degrees. We are very much overwhelmed, madam. Thank you so much.
Ready, ikkada.
డిజిటల్ పైకి వెళ్తే స్టూడెంట్స్కి వెళ్తుంటారు
Balaji, former Special Chief Secretary to Government of Telangana, to deliver his speech.
The First Lady of the Hyderabad, Mrs. Vijay Lakshmi, Dr. Saroj Bajaj, Dr. Mrs. Kothari, Dr. Marda, all other trustees, esteemed guests, press, and most importantly, the VVVIPs of today, the girls who have taken the degrees today, who have graduated today. A very good morning to all of you. I always feel very happy to come to this Mahila Dakshata Samithi and may see the enthusiastic faces here. There are two types of people here. One who take lot of joy and pleasure in giving, and then seeing the joy on the faces of other people. Those people sit here in this side, and some of them are not here. My salutations to them. And second type of people who have got lot of enthusiasm in them, they've got a lot of foresight, they look towards the future with lot of enthusiasm and bubbling pride at what they are going to meet the world and then what to do. Basically, I would like to talk to the girls who have graduated today, the nurses who become now nurses. Nursing is a very noble profession. To my mind, with due apologies to Dr. Marda and Dr. Marda, nursing I consider to be a greater profession than the doctors. Doctors stay with the patients for maybe 5 minutes, 10 minutes, half an hour. This is the nurses who take care of them for last remaining part of the 24 hours. And this is the most important input to the recovery of a patient is how he is nursed or how she is nursed. So nursing is a very great profession and your job is very important. Don't consider yourself to be inferior to anybody else, and you got entered into a noble profession and do it very nobly. While you doing so, please remember that this institution, what is the contribution of this institution in your lives? There are a lot of people, the God has been kind to them, and they thought that some part of this kindness they should pass it on to others. With their efforts, with their heartedness, all of you have got studied here, you enjoyed the college here, you studied here, you enjoyed the good education, you got medals, you got state ranks, etc. Who are behind this? Of course, your teachers, your principal, the people who are directly interacting with you, mentoring you, they are important. But the people who are behind this are the people who have made it possible. People like Dr. Saroj Bajaj and her team, the trustees here. You should be grateful to them is one thing. But what is more important in life is, you should make what they call sankalpa here, a commitment here today, that tomorrow when you come up in life, you will also inculcate similar kind of kindness, similar kind of kind-heartedness within you, and you will try to share a part of your good fortune to the people who are needy, like you were today, you were yesterday. So, girls, please remember this, that how you have come up in life, how you have got education, and when you come up in life tomorrow, and when you are in a position to do something for the society, you should also contribute your part to doing other society. I thank you all for giving me this opportunity. Dr. Saroj Bajaj and her team, some of them are present here, some of them are behind the curtains, they don't come out of the curtain. They always like to remain anonymous and behind the curtain. They don't want their names to be pronounced, they don't want their applause to be given to them, but we should be all very thankful to them. I have my salutation to all of them, and this should become a good example for the rest of the society, to something good for the people who need it. 700 girls who study here, 900 girls who study here, and most of these girls, now 900, I correct myself, 900 girls study here, and most of these girls are the girls coming from very poor background and from the rural areas. you must have been told, madam, that they make a special effort. Their scouts go from village to village and identify the girls who are orphans or who have troubled parenthood or who have got troubled situation in the families. Pick up those girls and bring them here, keep them here, feed them, give them good hostel, and then give them a good education. I was very delighted to see that some girls out of them have got state ranks. It's not a small thing that. It's not a small thing that a college gets a state rank. And so many state ranks we are seeing today, I'm very, very much delighted. These girls, most of these girls perhaps would not have got any education, but for the effort of these institutions. My salutations to the institution and all the people behind it. Hats off to them. And I hope that this becomes a shining example for others to follow, and many more similar institutions should come up in our society, so that the people who really need it can be taken care of. Government does the work, whatever they can do, but government's efforts have to be supplemented by human efforts by other philanthropes, other people who are capable of doing it. It's very important that in our Hindu philosophy also, they consider there are three types of rents. Rents is what you call indebtedness. One of the indebtedness is because society has given to us something, and when we are capable of doing, we should give it back to something to society. This is sort of a indebtedness. This is called Deshrin. So we have to give it back to society, and these people are giving the ample quantity and good abundance. Once again, my compliments to all of them, and my best wishes to all the girls who graduated from here. I am sure that you will do very good service to the humanity and to the medical profession. You will bring laurels. Thank you so much. All best.
Thank you, sir, for your motivational words. I now invite Dr. Sapna Malta, radiologist, Yashoda Hospitals, to address the graduates.
On the dais, Mahila Dakshata Samithi and Bansilal College of Nursing, students, guests, trustees, happy morning to one and all. I'm very delighted to be here. First of all, I take this opportunity to congratulate the members of Samithi for taking this great initiative of providing higher education to the girls here, the girls from the rural background. Otherwise, we wouldn't have got this opportunity. It's a wonderful service, ma'am, you all are doing very much. Next. Congratulations to all the girls who have worked hard, given their best, have come up with flying colors and made this institution which has given you this opportunity proud. I request all of you to clap. This clap is for yourself for taking up this opportunity. Many would have been given this opportunity, but you have chosen this opportunity. So it is for you. And for them, giving yourself, working hard, and then making this institution so proud by clearing and also getting good ranks. I congratulate all of you. Yes, I truly believe, sir, as you said, nursing is a noble profession. We cannot think of healthcare industry without nursing. Doctors, they see the patients, they diagnose their problems, and then they give a treatment plan. But who is the one who is going to implement that? It is the nursing staff. And I know the way you people do it, the warmth, the love, the touch, the care, the dedication you all have towards the patient. That is the thing that's going to help them to come out of this. Nursing, it's a really noble profession. Recently, my mother-in-law was admitted in hospital. She was there almost for a month. She was in a lot of pain. The way the nurses have taken care of her, it's hats off to them. The way they touched her life. She was always in pain, but by seeing that little smile in their face, she would smile back and forget her pain. They made her so comfortable. They treated her with so gentleness. I have seen it. I'm on the other side of the picture. I'm a doctor. But when I was from the patient side and have seen the nurses doing that hard work, it was really touching. And I'm so happy I appreciate all of you for taking up this noble profession. Nursing is in great demand now. You know, there are so many hospitals that are coming up, and you all have lot of opportunities. Utilize the opportunity. You have a bright future. Believe in yourself. There are few things that I would like to share which I have implemented in my life and that has made a difference. First is knowledge. I know everyone here would believe that knowledge is wealth. So acquire as much as knowledge you can acquire. We need to improve our skills. You are the young generation. You have lot of enthusiasm. You have a great memory power. You have a grasping power, and you can learn things just like that. For an old age lady or an elderly, it will take lot of time. But you being in the teenage and 20s, you have lot of energy. So utilize that. Improve yourself. You can improve yourself in academic field. Give yourself time. When I was in my college days, I didn't have lot of technology to my use, but you all have mobile phones in your hand. You have internet with you. Every data is there in the internet, but utilize it for your own growth. Learn from it. There are many online courses you can learn. There's so much to learn. Utilize the internet for your growth, and from the knowledge you acquire from that, use it for the betterment of the society, the betterment of the patients. You can learn. Suppose one of you want to be an OT sister, you can see the videos what are the skills needed by an OT sister. One of you may want to be in an emergency ward, what all skills you need to be in an emergency ward. Everything is available. You have to go through proper training, but then you can take the internet for advantage. I know it has to be used in a rightful way. I would always say use it for your growth and for the growth of the people around you and for the society. I'll give you a simple example. I have done my MD radiology in Warangal. I had ultrasound, X-ray, CT. I didn't have MRI then. I was so excited. I always had a desire to learn MRI. But once I finished my MD, learned all these things, after my MD, PG, I went to Mumbai, Ahmedabad, wherever I could go to learn. I learned MRI. I went to Tata Memorial Hospital in Mumbai, Nanavati Hospital, where MRI is taught. I learned it, and today I can proudly say that I report a lot of MRIs with confidence. Then I was not satisfied here. I still had this desire to learn, and that's what I want to tell you. Keep learning, keep growing. I wanted to improve my academic skills. Even though I was a consultant in Yashoda Hospital, I wanted to do something else. I wanted to learn something. So I wrote UK-based FRCR and Singapore-based MMed exam. How would I do it? I used to work 8 hours in the hospital, sit back in the hospital library, sit till 12 o'clock and learn. And that's the way how I got my Frank Doyle medal in UK. I was just like you all. I attended that convocation, and by seeing all of you, I can recollect those days. That happiness, that what we go through, I can really feel that. So just keep learning, keep growing. That's it. That is what this is for academic skills. When it comes to extra academic skills, extracurricular activities, we need to improve a lot. Language. I don't know how many of you know how many languages. Suppose one of you may want to settle in Telangana and you don't know Telugu. Don't say Naku Telugu Radu. Learn Telugu. If you are settling here, or you may be going to another place, wherever you are going, learn the local language. And when you speak to patients in that local language, that makes a lot of difference. I can give you a simple example. My husband is sitting here, Dr. Sachin. He's from Maharashtra background. Unknowingly, we have settled in Hyderabad. The destiny has got us here. He did not know even a single word in Telugu. But in last few years, he has learned Telugu. And you'll be surprised. How did he learn? He learned it from radio. He used to listen to that radio girl speaking. He would pick up those words. He would pick up the words what the patient speaks. For first few days, he had help. But then he took those words. He would come and ask me, what does this mean? And in few days, he learned it. So you can learn a new language. You can learn other things like communication skills. It's very much needed in our profession. We need to speak. So girls are usually shy when it comes to speaking, but for this noble profession, nursing, medical, everything needs good communication skills. So learn how to communicate. Only when you know how to communicate, you can communicate what the patient says to the doctor and what the doctor says to the patient. You are the lifeline. You are the connecting bridge between we, the doctors, and the patients. So have wonderful communication skills. So knowledge, keep learning, keep growing. The second thing I would say is self-discipline. Have a plan for every day. Have a to-do list. Do it every night. You have mobile. You can just make a scheduler or a reminder in that. You make sure that you write down your to-do list, and once you finish the day, before you sleep, make sure that you look at the list and tick what all you have done, what is remaining. If it is important, do it on the next day. Make sure you do everyday basis. And also maintain a diary. Write down your short-term goals, write down your long-term goals, and it has to be time bound. Time is limited for everyone. So you have to have time bound goals, and you have to write down the way, the process you have to do to reach that goal. And then third is CDSIE. This is the mantra that is taught to all of us by our Guru Mahatriya, and that's what this mantra helps our desires, our goals to become reality when we apply. It is consistent, directed, intelligent, self-motivated, intelligent of effort. So you have to be consistent. You want to take up yoga, make sure you are consistent till you learn it and then implement it for your own health. Anything you can take up, but be consistent till you learn it, till you master it. The second is directed. You should have a goal and you should work towards that goal. Suppose from here I want to walk straight ahead, but instead I make a little 1 degree deviation and now I go. It may look as if it is a very simple, just 1 to 2 degrees deviation. But in the long run, when I'll walk far ahead, I'll come to know that I'm not where I am supposed to be. I was supposed to be here, but I am here. So even that little deviation makes a difference. So have a directed goal and work towards it. Then comes the self-motivation. People will come and motivate you. I'll motivate you today. Madam will come and motivate you today. But this motivation will last only for short duration unless you are motivated from within. The self-motivation is the sustained motivation. The spark has to come from within, and only then it will be long-lasting, and that will help you to reach your goal. Next is the intelligence. Yes, you have to be intelligent. You have to be smart enough. You can't do things haphazardly. You have to have an intelligent effort, a smart effort. And the effort, the activity that we have to do has to be done. Who is your favorite dancer in Bollywood industry or in film industry? Hrithik Roshan, Prabhudeva. Yeah. How when they dance, it looks so seamless. You feel as if kitna easy hai ye step. You can just do it. Try it. You'll not be able to do it that way. Why? We feel that they do it so effortlessly, seamlessly. But how is it happening? There's lot of effort, lot of practice that goes behind the scene. They have learned, they have put lot of efforts to be what they are. So we also, every field, whoever you take, everybody, if you are seeing this program going so smoothly, so seamlessly, how is it happening? There's lot of effort by all of these people, all this management and your teachers, that you are able to see it going so seamlessly. So behind every effortless work that looks like seamless, there's a lot of effort that goes. So make sure you can make your desires reality by doing this CDSIE. I wish you all the very best. I believe that you all will make it very, very big in life. You all have a bright future. You have a lot of opportunities. Believe in yourself. Have faith in yourself. And you will make it proud. You will make your parents, your institution proud. Thank you so much. Thank you for the opportunity, madam. I feel privileged and honored to be among all of you. Thank you so much.
Thank you, madam, for your encouraging words, and you have given so many practical tips to the students. I hope the students will emulate and follow in their life and future. Thank you, ma'am. Now we have the most prestigious moment. It's my privilege to request our esteemed chief guest, most respected Srimati Gadwal Vijayalakshmi Madam, to please deliver the graduation day address.
Good afternoon to all of you first. It is indeed a happy moment to be among you this afternoon for the convocation ceremony of nursing students of Mahila Dakshata Samithi and Bansilal Malani College of Nursing. The dedication and commitment of the Mahila Dakshata Samithi is clearly visible in their motto for empowerment of women through higher education by establishing the nursing college in the year 2016. I would like to congratulate each of the nursing students who have passed out successfully. Would also like to congratulate the entire staff and support of Mahila Dakshata Samithi and Bansilal Malani College of Nursing. First, let me tell you one thing. Mrs. Saroj Bajaj is a good friend of my father. So she just came 2 months ago and talked to my father, said, she needs to come, the mayor needs to come for the convocation of the nursing college. My dad just agreed and said, fine, yeah, she'll be there. And then I did not know nothing about nursing, nothing about the college, and nothing, just I'm blank. And then comes 2 days, I was supposed to come here and speak about, this nursing student. Then I called Mrs. Bajaj and said, ma'am, I do not know anything about this. You haven't told me anything. After coming here, I realized there are donors and how the institute is really surviving. So she told me little background about it, and she wrote me a draft speech. I said, it's okay, ma'am. I think I can prepare my own speech by looking at this draft speech. But next time, it'll be really nice if you come to me and tell me what this convocation is about, because really I have not attended. I know I come from a political background, might not be knowing too much about nursing, and it was such an inspiring speech by Swapna ji. She really could relate so well with the students here. I might not, so if I speak, I wrote down whatever little bit that I went through Google, and I had to really search for it. Talk about political, I would just speak. I would go on and on and on. So excuse me, I might not be as fluent and as good as Swapna ji, but I'll try my best to what I have written. So, as you all know, in India, women are always held in high regard. They are considered Shakti, but in practice, it is nearly reverse. The answer to this is education. Education of women plays an important role in the advancement of the society. Education is a milestone of women empowerment because it enables them to respond to the challenges, to face their traditional role and change their life. It assists in bringing equality, work as a means to improve their status within family, society, and politico-economic system. Empowerment is the process of enabling or authorizing individual to think, take action, and control work in an autonomous way. It refers to liberation from oppression or bondage of any kind. In other words, it is understood as the emancipation of the individual into a wider cultural space. Here, education is very vital element for bringing empowerment. It can bring lots of attitudinal changes, which is very crucial for socio-economic and political progress of the country. Thus, the necessity of education is not only for male, rather women too. The education system should find the way for inclusive development of women. Having thus spoken on education, particularly women's education, as a potential social mobility factor, let me turn to your specific subject, nursing profession and its values, nursing education is dominantly women's education. The very first fact that we address nurses as sisters vindicates the high respect we hold for them. Nightingale is the example. It could be due to their service to suffering patients or behavior of their values. The last is very important. To my mind, the values of human quality that they possess is great. The nature of kindness they usually display while treating patients with kindness and thoughtfulness. Compassion is a value that is important to nursing. Profession, being compassionate helps patients feel respected during medical care, as Swapnaji said. Just that little smile of yours will make a patient's day. Because I did work in US for about 15 years, but I was not totally connected to the patient, but I was in research. Yes, it really mattered so much because the medical practice here is so different from the US. There, a drug addict, anybody. I mean, here a patient has a support, a family member comes with the patient, they get admitted. But there, we literally pick up the patients from the streets. The drug addicts. There's so many different kinds of homeless people. We bring them from the street. We admit them because they need help. There is no family there. So we come. So, they try to spit on you. They try to be very aggressive. But, your compassion, your attitude towards that patient helps so much. You trying to give one little smile makes them, so happy, as she said, how her mother-in-law felt. It is with every patient, believe me. Everybody wants that compassion, that affection. So all the nurses today, that's what Swapnaji said, is so rightly said that we all need to be, I know as nursing students, you must have studied a lot and, did lot of hard work, and once you get out, some people like I studied so much now, I have to just give it, this is my job, I just have to go 9 to 5 job and then just come out. No, what she said, compassion and affection, that's all is needed for us today. So besides in nursing, loyalty is vital to connecting with patients and providing ethical quality care. Loyalty refers to making honest, moral decisions. Patients may have more confidence in nurses who perform their duties with dedication, which makes patients more comfortable and willing to receive necessary treatment for their illness, as I already told you about. Nurses are altruistic. Altruism is not to expect something in return. Again, so don't just go there to work expecting, tomorrow I might get, if I do a little bit of service, I might get one laurel, or, the so concerned supervisor might give you a crown on the head. No, this is you are doing, don't expect. Nursing profession is one thing. Please do not expect anything back. You should always give what, as she said, you're taking something from the society, you're learning so much from this institution. What you need to do is you need to give it back to the society. I'm not just talking about nursing. Even today as a politician, I might be coming from a political family, but I have started just like any other not ordinary person, not as Kesharav's daughter, not as an MP's daughter. I came back, gave up my US citizenship. And I said, I think I need to do something for the society. That's when I did my law college. I did my law here. And I said, I want to do something for these women, because I saw then, when I came back like 15 years ago, I saw women were not coming out of the houses, especially in the slum areas where we live there in Banjara Hills. It's just called Banjara Hills, but you see a lot of slum. Mrs. Sarojji also knows about it because I went campaigning there. So I said, I'll do something for women. So I told them, and they go through a lot of domestic violences. So what I used to do is call them, just give them little counseling, give them little courage, encouragement that, she's a woman, she can, apart from household work, she can do so many other things. A woman has more creativity, actually. So I would tell them, this is the time you spend in the kitchen, this is the time you spend for your children and your husband, remaining time spent for yourself. Recognize yourself, what creativity you have in you, and just come out with that. This is how I really work towards the downtrodden women and really empower these women. Today, in Banjara Hills area, where I represent, I see so many, more than men, I see women come out. Women come out, standing on their feet. They tell me, ma'am, can you do these skills, this development skill program for us? Can you do? They come up with different ideas to me. So which feels really, I feel really proud as a woman that we could do. So I'm talking, today a woman needs to give a helping hand to another woman. Because that doesn't happen here. That doesn't happen. I haven't seen too many people doing that. But nowadays, like lately, what I'm seeing is, lot of these organizations, lot of organized women entrepreneurs are coming with different things. And, this is what they're encouraging women to do. And I sincerely wish every woman should encourage another woman. That's how we can just come up in the society and bring empowerment to ourselves. So, then again, I'm talking about social justice is what we ask for. The value of social justice means understanding and upholding moral and equal healthcare standards for every patient. You may practice social justice by actively listening to needs of individual patients and providing them with treatments irrespective of their social status. This way, they feel more comfortable and trust in your abilities. Exactly. This is exactly. First, when I came back from US, I just thought to myself, because I belong to the research, I said, I will go join NIMS hospital, give little counseling, because not everybody, a patient that I asked sometimes, what are you doing? What is happening to this bed? Ma'am, they would tell me in Telugu, anything heart problem. And they said, they have a different thing that they would tell. I cannot tell now because I don't remember how. Anything heart problem. I said, what is heart problem? They all say, first they'll say heart attack. Then I said, how? Then I said, no, they really need counseling. Because in US, you will not believe the consent form that a patient's family or the patient signs, it is written in a second standard, the second class standard. So that when you read it, everybody would understand what he is going through, what kind of a treatment he is getting in. Here, it's not like that. You go to a doctor, you go to a nurse. Sometimes I feel doctors are much better, but I'm not discouraging the nurses. I'm saying few people who have attitude. They're very senior to a doctor also. But I saw their attitude. Once I saw that, I said, no, this is not my profession. Because what I saw 15 years there, different here, different in India. So now it's changing due to lot of privatization. Lot of private hospitals and and also now lot of government hospitals also. First thing they tell you is how to treat a patient, how polite you should be. Even in human resources, like say GHMC where I work, first thing I keep calling the control room to just see how their attitude is. I myself call them. So are they polite to my customers when they try to give the grievances? This is all matters. What I'm saying is attitude matters a lot when you're treating a patient, especially to the nursing students. You cannot, if the patient is trying to, please listen, please stand there for a second or for a minute. Just try to listen. I know sometimes it doesn't make sense to you, but it makes lot of, they need that, somebody is listening to me. If not my family, at least my nurse is listening. So tomorrow they'll say, okay, I can stay by myself in the hospital. You don't even have to come. See, this is how nurses should treat the patients. So it will also be good if our nursing professionals lend their ears to the needs of the patients. This is an ethical value that aims to respect and not influence a patient's healthcare choices, which may make patients feel more at ease and encourage them to seek other healthcare services when they need them. Another point I want to stress is concern, which helps nurses see a situation from their patient's perspective. You can use this to address a patient's concern from their point of view, which is helpful when educating them about procedures. Exactly what I said, how the procedures are done in US, and here doctors don't even tell, don't even discuss. I mean, the nurses don't even, they just say, okay, we're getting ready, you just wear that gown and we're just ready, taking you to the operating room. No, I think a 5-minute little brief them about what procedure they're going to go through, what exactly will happen afterward, what is that they're going to see after effects. See, if you explain to them, that will help a patient. I did I was in stenting, heart stenting. We did a lot of procedures, and I did a study on this stenting. We did therapeutic a mantra, the music that they like. We would we would ask the patient what kind of music do they like. So once we engage them in that music for about 5 minutes before taking them to the stenting procedure, it really relaxes their body. Totally, they're so relaxed, they don't even know they're going to the procedure room, and the arteries open so easily, and the stenting procedure is done in 5 minutes. So this is how we did. I did so many stenting procedures because I participated in a lot of world stenting things. So this is exactly what happens. You need to basically, I know doctors do, but for in comparatively, I'm comparing because I was there too long, 20 years in US, and I was in the hospital, Duke University, for about 15 years doing this. This is what, first the doctor talks, resident talks, and then the intern talks, then again the nurse talks, then again the head nurse. I mean, so many people talking that the guy already knows what he's going through, what to be expected, and what the next thing is going to be. So this is what is so valuable. I mean, this is what you guys need to do, is please talk to the patient. Talk to the patient, listen to them for a minute. So nothing goes, in your 8-hour shift, 1 minute doesn't matter, right? Yes. So as a nurse may value loyalty to their job and their patients most. This may mean they dedicate themselves to patients' well-being. Excellence in your field is what the society expects from every professional, not only just nurses, from me, from politicians, from bureaucrats to the teachers, everybody. This is what the people expect. Whatever profession you are in, we need to do our best because we have chosen it. We have chosen. Nobody asked you to choose it. So we've chosen it. So we need to do the best that we can. Nurses are not an exception. So as I'm saying, everybody is equal. Everybody's profession we need to respect. So finally, I would like to thank Mrs. Saroj Bajaj and also the team, her entire team, for inviting me today for this event. Thank you once again, and I congratulate all the nurses, and I hope you do the best. And I hope whatever Sapna ji and Vinod ji, Saroj ji, and I spoke, will just get into your mind and do your best in your profession. Thank you.
Thank you, madam, for sharing your experiences and for your enriching speech. Now we have Mr. Vamshi from Infosys.
So I'm representing Infosys on the stage. So we have decided to support 25 students for their entire 4 years nursing course, as well as 8 students for the final year. So I've just come to give the first check to Saroj Bajaj, and this event couldn't have been the best. So I'm so glad I'm here on the right day, at the right time, and thanks to all the dignitaries to give me this opportunity. Yeah, thank you.
Thank you, Vamshiji. Please convey our thanks to Manisha Sabu madam, Mrs. Padmaja Ramani too. Thank you for your kind gesture. Now I request Mrs. D. Lakshmi madam to please come forward to propose the vote of thanks. Thank you, Vamshiji. Please convey our thanks to Manisha Sabu Madam, Mrs. Padmaja Ramani too. Thank you for your kind gesture. Now I request Mrs. G. Lakshmi Madam to please come forward to propose a vote of thanks.
To bless our students of our college and the convocation function. I thank Srimati Vijayalakshmi Garu, Honorable Mayor of Government of Telangana, have accepted our invitation and graced the occasion. Thank you, Madam. Without knowing anything, you told so many things, and I thought when she was telling, I don't know anything. She knows everything, and she has given a really college principal or a lecturer can say all the things she has told the nurses. I hope all the students who have passed the nursing should take the advices whatever she has given and Dr. Shia Paparna also has given. I think so. Please give a big clap for her. Thank you, madam. Thank you very much for your so much information you have given to the students. My heartful thanks to Dr. Mrs. Sapna for the radiologist, Yashoda Hospital, even her busy schedule, and she has graced the occasion. Madam, really you have given your doctor knowledge, complete nursing. That's all we require. And I hope all the students will take the advice what she has given. Really, it is a wonderful. I can understand the things. We also understand what is a doctor and what is a nurse. Thank you very much, madam, for your presentation. My special and heartful thanks to Sri Vinod Agarwal ji. साहब हाथ जोड़ के नमस्ते आपके. My heartful thanks to Special and heartful thanks to Dr. Vinod Agarwal ji, former Special Chief Secretary to the Government of Telangana, who is always our well-wisher in all our activities of the college. Thank you, sir. You so much you help us. We know that through our Madam President, Madam Saroj Bajaj ji. Thank you so much. You have given a wonderful speech, and the motivation speech is very nice. Even though we are not doctor or a nurse, but as a Chief Secretary of the Telangana, you have given a very good tip for the students today. Thank you very much, sir. The Mahila Dakshata Samithi Degree College was started in the year 2001 for the purpose of the empowerment of the women through higher education for the weaker sections. And the nursing college was started in the year 2010. The section girls, students from rural areas who are on their own do not come forward for the college education. Students include orphans, daughters of single parents, agricultural labor children, and since 4 decades, Mahila Dakshata Samithi is continuing the education to poor and needy girls. Behind all this educational institution, development and dedicated women is only one lady and woman is Dr. Saroj Bajaj. Please give a big clap. Dr. Saroj Bajaj, who always 24/7, I am telling the truth, 24/7, think about the development of college and facilities to the students and the good education, and dedication and devotion and hard work for all these years. We can see the college's development year by year. Please give them a clap. Please stand, all the students. Give a standing ovation to our great lady, woman, Dr. Saroj Bajaj. Thank you very much. Thank you very much. Her motto is help to poor and needy girls for empowerment the women. Really, she is a role model for any woman in the society. The government will do is entirely different what our great lady mayor told us. But what the society
the normal human beings should do the society. That is our Dr. Saroj Bajaj ji. All these years. I thank Srimati Aruna Malani ji, the Secretary Nursing College, for her support. Madam, thank you very much for your support. I thank the Rajashri Jain Trustee of Mahila Dakshata Samithi. Okay. Madam, thank you very much for your new hostel, what you are supporting. Thank you very much from the Mahila Dakshata Samithi and all our members. I thank all the invited guests, college staff and members and lecturers who have made this function a grand success and colorful. I thank my sincere thanks and special thanks to Mr. Salim and Mr. Gauss and all the press and electronic media for being present here today. And I thank all the members. Thank you everyone. Thank you one and all. Thank you very much.
I request Ms. Deepa Dadu to please come forward to give the gift hampers to the dignitaries on the dais. Now let us all rise for the national anthem to be led by the BSc Nursing first year students.
जनगणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय